Imagine trusting a doctor with your life, only to discover that the person meant to heal you is the one who ultimately causes your death. Imagine you're lying on an operating table, the cool, sterile air surrounding you, a sense of unease tugging at the back of your mind. The mask goes over your face, and everything begins to fade into a haze of nothingness. For most of us, it's a moment of trust, a fleeting moment where we put our lives in the hands of someone who's sworn to protect and heal. You'd think that in that vulnerable moment, nothing could possibly go wrong. But in November of 2010, something unimaginable did. Jessica Miller, a 32-year-old mother of two, was about to undergo a routine gallbladder surgery at Mercy General Hospital in Jackson, Mississippi. For her, it was supposed to be a simple procedure, a minor discomfort in her already challenging life. She had no reason to think that as she lay there under anesthesia, she was placing her life in the hands of someone who harbored the potential for unfathomable harm. Dr. Sandra West, a well-respected surgeon with over a decade of experience, was supposed to be her healer. She was trusted, experienced, and skilled. But somewhere, in the course of that surgery, something went terribly wrong. At first, it didn't seem alarming. There was no immediate crisis, no signs that something had gone wrong during the surgery. Jessica woke up in the recovery room, groggy, but that was to be expected. She began to feel discomfort, something uncharacteristic for a procedure of this nature. The recovery staff brushed it off as a complication, but it wasn't long before things began to unravel. What should have been a few days of rest and recuperation stretched into weeks of suffering. Jessica's condition deteriorated rapidly. She had unexplained fevers, weakness, and eventually, a host of strange symptoms that no one could quite explain. The doctors were puzzled, struggling to determine what had gone wrong. A simple infection, maybe? Some minor complication? But as days passed, Jessica's health took a turn for the worse. This wasn't the kind of mistake you could chalk up to the usual human error. No, something deeper was unfolding. It wasn't long before tests came back showing a horrifying truth: Jessica had contracted HIV during her surgery. And not just that. The virus had been introduced into her body through the very hands meant to heal her. The hospital was in disbelief. How could this happen? How could a highly trained surgeon, trusted by so many, be involved in something as egregious as this? It wasn't possible, was it? But there, in the quiet sterile corridors of the hospital, whispers began to grow louder. They spoke of the unspoken moments during the surgery. Things that didn't sit right, things that were swept under the rug. And all the while, the woman responsible, Dr. Sandra West, remained calm, her face an unflinching mask of professionalism. But what was her motive? Why would she risk everything for something so horrific? Could this be an accident, a mistake, something beyond anyone's control? Or was there something far more deliberate at play here? As Jessica's family struggled with the mounting confusion and distress, David Miller, her devastated husband, couldn't understand why his wife's condition wasn't improving. There were unanswered questions, and the hospital staff was becoming increasingly concerned, each one wondering if they had missed something. The truth was slipping through their fingers, but they just couldn't see it. They couldn't believe what was right in front of them. As investigators began to peel back the layers, what they uncovered shook them to the core. The first clue was a discrepancy in the medical records. Vital information missing or altered, and medication notes that didn't add up. Soon, a breakthrough came: a contaminated needle, a drug the doctor had been caught using, one she had no permission to administer. But why? What had led Drive West to this point? How could someone who had dedicated their life to medicine, someone who had saved so many, turn into the very thing they had sworn to protect others from? The more investigators dug, the more disturbing the revelations became. It wasn't just this one incident. There had been others, too, other patients who had unknowingly suffered at the hands of someone they trusted, people who had no idea that they were merely pawns in a much larger scheme. What was the true nature of Drive West's actions? Was this just a case of negligence gone terribly wrong, or was there something more? No one knew. But the deeper the investigation went, the closer they came to uncovering the horrifying reality. Dr. Sandra West had been infected with the virus herself. She had been using unsterilized needles, and there were traces of drugs that weren't prescribed anywhere in her records. It wasn't a case of carelessness or bad judgment. This was something much more deliberate. And then, one night, the truth came out. Dr. West confessed. She admitted, in chilling detail, what had been done, how she had deliberately injected her patient with HIV during the procedure. Her reasons were hazy, hard to comprehend, but the facts were clear. She had betrayed everything she stood for. She had betrayed her oath, her patients, and the very people who had trusted her with their lives. The arrest was swift. January 10, 2011. Dr. West was charged with second-degree murder, malpractice, and willfully infecting Jessica Miller with HIV. The trial that followed was a spectacle, one that rocked the small town of Jackson to its core. Jessica's family was devastated beyond words, left to pick up the pieces of their lives, trying to make sense of a world where a trusted professional could do something so unimaginable. But even as the legal process unfolded, there remained a deep sense of unease. The hospital had swept incidents like this under the rug before, and many were left wondering if Dr. West had acted alone. Could this have been part of a larger conspiracy, or was she simply a rogue doctor who had gone too far? And if this was just the tip of the iceberg, what else might be lurking beneath the surface? As the case moved to trial, the truth was slowly being revealed, piece by piece. The once pristine reputation of Dr. Sandra West began to crumble, and with it, the trust of an entire community. And as the world watched, the lingering question remained, how could this happen? How could a woman whose very purpose was to heal, betray the most sacred trust of all? The consequences of that betrayal were far-reaching, and the scars would never truly fade. For Jessica Miller, her family, and the many others who would be affected by the ripple effect of Dr. West's actions, the truth would never be enough to bring closure. This was a story of betrayal. A story of misplaced trust. A story that would haunt the residents of Jackson for years to come. But for now, the questions remained, unanswered and echoing in the quiet halls of Mercy General Hospital. The case took a turn no one could have anticipated. As investigators began combing through every aspect of Dr. Sandra West's life and medical history, they uncovered a startling pattern, one that seemed to stretch back far before Jessica Miller's tragic fate. Dr. West had been the subject of whispers for years, but no one had ever dared to investigate her. For most, her calm demeanor and her pristine reputation were enough to dismiss any rumors. But now, the whispers were turning into something much more serious. Through confidential interviews with former colleagues, nurses, and even patients, a disturbing picture of Dr. West began to emerge. It wasn't just one mistake, one unfortunate lapse in judgment. There were signs, small but significant, that indicated this wasn't an isolated incident. In the months before Jessica's surgery, several patients had reported unusual complications after their procedures. These patients had been given the best care, or so they thought, and yet they found themselves suffering from inexplicable infections, prolonged recoveries, or bizarre symptoms that didn't make sense. The breakthrough came when investigators managed to gain access to Dr. West's personal medical files, a move that would later come under fire for its legality. However, what they found in those files sent shockwaves through the entire investigation. There, among the prescriptions and notes, was a series of treatments that didn't add up. There were records of prescriptions for HIV medication that was not listed as part of any known treatment protocol for Dr. West's medical conditions. And more alarmingly, Dr. West had recently been treated for a serious infection, one that she had kept hidden from her colleagues. The exact nature of the infection was never fully disclosed, but it was clear that something had been wrong with her health for quite some time. As investigators dug deeper into Dr. West's history, they discovered an alarming trend. She had been disciplined multiple times by the medical board for minor infractions that were conveniently swept under the rug. Each time, the hospital chose to overlook her behavior, attributing it to stress or personal problems. But when they connected these past incidents with Jessica's case, a chilling truth began to surface. It was becoming clear that Dr. West had been hiding something much more dangerous than anyone had suspected. By now, Jessica Miller's condition had worsened significantly. Despite the hospital's best efforts, the infection continued to ravage her body. Her immune system was weakened beyond repair. Her family, unable to understand how a routine surgery had turned into a life-or-death struggle, fought to keep hope alive. But Jessica's fate was sealed. Within weeks, she passed away, leaving behind 2 young children and a grieving husband who could not believe what had just happened. David Miller, her husband, was shattered. He couldn't understand how the woman he had entrusted his wife to could cause her so much harm. He knew something was terribly wrong, but it wasn't until the hospital issued a formal statement that things began to make sense. The truth slowly came into focus, like a dark cloud revealing itself after a storm. Investigators then found a crucial piece of evidence that tied Dr. West's actions to a pattern of deliberate harm. A colleague of Dr. West's came forward, revealing that the surgeon had been stealing medications from the hospital's supply room, specifically, HIV-contaminated needles that had been improperly disposed of after use. The colleague claimed that Dr. West had, on several occasions, used these contaminated needles on patients without their consent, while also tampering with their medical records to cover her tracks. The idea that Dr. West had intentionally infected her patients with HIV wasn't just a theory anymore, it was fact. It wasn't about accidents or mistakes. She had knowingly used those needles to inject vulnerable patients. And Jessica Miller, a woman who had trusted her with her life, had been the latest victim. The motive behind it all was still unclear, but investigators were beginning to piece together a much darker picture. But this was just the beginning of the horror. The truth behind Dr. West's actions, the series of events that led to Jessica's death, was still waiting to be uncovered. The town of Jackson, Mississippi, was about to be rocked by the truth in ways no one could have predicted. The trial was set to begin, but what would be revealed in the courtroom was far more than anyone had imagined. As the case began to unfold in early 2011, the public's interest grew exponentially. The media descended upon Jackson, covering the case with an intensity that only true crime stories can inspire. People from all over the country watched in disbelief as the details of Dr. West's crimes were revealed, one horrifying piece at a time. Her courtroom appearances were a spectacle, with the accused surgeon sitting quietly, almost detached from the proceedings, as if she had no concept of the weight of her actions. In court, the prosecution painted a chilling picture of a woman who had used her medical knowledge and trust as a weapon, turning a position of power into a means of inflicting harm. They called upon experts in infectious diseases, medical malpractice, and psychological analysis to help the jury understand just how calculated and deliberate Dr. West's actions had been. They painted a portrait of a woman who had fallen from grace, driven by something far more twisted than a simple lapse in judgment. The defense, on the other hand, tried to paint Dr. West as a victim, of stress, of exhaustion, of a system that had failed her. But no amount of excuses could distract from the overwhelming evidence that Dr. West had intentionally caused the deaths of her patients. The coldness in her eyes, the indifference to her victims, and the shocking revelation of her history all pointed to one inescapable truth: Dr. Sandra West was not a victim. She was a murderer. The courtroom erupted in shock and disbelief when Dr. West took the stand. Her confession came not with remorse, but with a chilling calmness that sent a wave of discomfort through the audience. She spoke plainly, as if recounting an event that held no emotional weight for her. She described how she had come to use the contaminated needles on patients, and how she had concealed the truth from her colleagues, watching as people suffered under her care. There was no explanation for why she had done it, just a detached recounting of her actions. In the end, the verdict was inevitable. Dr. Sandra West was convicted of second-degree murder, intentional infection, and a host of other charges related to malpractice. She was sentenced to life in prison without the possibility of parole. But even as the legal system rendered its judgment, many were left wondering what could have driven someone like Dr. West to commit such heinous acts. Was she driven by personal demons? A desire for revenge? Or was there something even more complicated at play here? In the months following Jessica's death, several other former patients of Drive West came forward, each with their own harrowing stories. They, too, had suffered mysterious infections, prolonged illnesses, and medical complications that had never been fully explained. For these patients, the discovery that they had been infected with HIV during their surgeries was a nightmare come to life. Many of them had been left with irreversible damage to their health, and some had even lost loved ones to complications stemming from the infections. The emotional toll was immeasurable. Families who had once trusted the healthcare system were now questioning everything they thought they knew about the people who were supposed to heal them. But there was no turning back the clock. The damage had been done. As for the family of Jessica Miller, the journey to find justice was far from over. Her husband, David Miller, remained consumed by grief, but he knew that he had to take action, not just for his wife, but for the countless others who had been harmed by Drive West's actions. David became an outspoken advocate for victims of medical malpractice, using his own tragedy to raise awareness about the need for greater accountability in the healthcare system. He worked tirelessly to push for reforms in hospital oversight and patient safety protocols. One of the most painful realizations came when David discovered that Drive West's actions had likely been going on for years. There were rumors that she had been involved in other incidents of malpractice, but they had never been investigated thoroughly. In interviews with investigative journalists, David began to connect the dots. He found out that in the years prior to Jessica's surgery, there had been a series of unexplained patient deaths and near-deaths at Mercy General Hospital, many of which had been attributed to complications or unknown causes. As it turned out, these deaths were not isolated events, they were the result of Drive West's deliberate actions. The media coverage of Jessica's case exploded once again as new details emerged about the extent of Drive West's crimes. The hospital, now facing mounting lawsuits and an increasingly toxic public image, was forced to make changes. The board of directors resigned in shame, and a full investigation into the institution's failure to address Drive West's behavior was launched. It was a painful process, but it was necessary to restore some semblance of trust in the system. Months passed, but the emotional scars left by Drive West's actions would not fade. The trial and subsequent conviction had brought a sense of closure to many, but for those who had been personally affected, the damage went far beyond the courtroom. Jessica's children, who had been just toddlers when their mother passed, would grow up without the woman who had loved them. Their lives would be shaped by the loss, and they would always carry the burden of knowing that their mother had been the victim of something unspeakable. Even years later, whispers continued to circulate about the true extent of Drive West's crimes. Had she acted alone, or was she part of something larger? There were theories, of course. Some suggested that there had been others involved, that Drive West had been part of an underground network that targeted vulnerable patients. However, no concrete evidence ever surfaced to support those claims. Still, some members of the community remained unconvinced. The idea that one person could have caused so much pain and suffering was difficult for many to accept. The truth, it seemed, was far more complicated than anyone had imagined. As the years went by, Dr. Sandra West's name became synonymous with betrayal. She was locked away in a high-security prison, but her presence still loomed over Jackson. The hospital, though it had undergone significant reforms, could never escape the shadow of the tragedy that had unfolded within its walls. Patients, staff, and families alike were left to grapple with the unsettling reality that someone they had trusted had violated the sanctity of the very profession meant to protect life. Despite the horrific nature of the case, some positive changes did come in the wake of Drive West's actions. The hospital system in Jackson, and many others across the country, instituted stricter protocols for oversight, transparency, and reporting of medical malpractice. Laws were passed to increase accountability in the medical field, and whistleblower protections were strengthened to ensure that those who witnessed dangerous practices were protected from retaliation. Yet, for all the progress made, the scars of the past remained. No matter how many reforms were implemented, the memory of what had happened to Jessica Miller and so many others could never be erased. The story of Drive West's betrayal of trust would forever serve as a stark reminder of the fragility of life, and of the need for constant vigilance in the systems that are meant to protect us. In the end, the tragedy of Jessica Miller's death and the lives shattered by Drive West's actions became a story that people would never forget. It was a tale of horror, of betrayal, and of the haunting question that would linger in the minds of all who heard it: how could someone who had sworn to do no harm, someone who had dedicated their life to saving others, cause so much destruction? For the survivors, the victims, and the families who were left to pick up the pieces, the story of Dr. Sandra West was a reminder that evil could sometimes wear the face of a trusted professional, and that the true cost of betrayal could never truly be measured in any courtroom. As we close this tragic chapter of medical malpractice, the questions linger: what drove Dr. Sandra West to betray the very trust placed in her hands? How many other lives were unknowingly affected by her actions before Jessica Miller's case? What do you think about the changes in the healthcare system that followed? Do you believe enough has been done to ensure this doesn't happen again? And, most importantly, do you think the true extent of Drive West's crimes has been fully uncovered? If you found this story as chilling and disturbing as we did, we urge you to share your thoughts. Was justice served in the right way? Do you think there were others who may have been complicit in her actions? Share your theories and your opinions in the comments below. If you want to hear more true crime stories that delve into the darkest corners of the world, make sure to subscribe to our channel, so you never miss an update. And if you found this story shocking, don't forget to like and share it with friends and family to raise awareness of the need for accountability in the healthcare system. Your voice matters. Let's keep the conversation going.